How long does a SMAS facelift last? A SMAS facelift can last 10 to 15 years. And the way that this works is basically you're rewinding time, lifting things back up to where they used to be, so you look at least 10 years younger. So if you did one facelift and you never did anything else again, you should always look about 10, 15 years younger. But in about that time frame, you may start to notice some of those same changes, some of the jowling, some of the laxity in the neck, and something that maybe you would want to do a little touch-up or something like that out to improve your appearance. Some people do, some people just always look 10 to 15 years younger. What is the difference between a deep plane and a submuscular aponeurotic system facelift? So there are a few different types of facelifts, and there's always been a debate of which one is the best. And honestly, the best is what is best in your surgeon's hands. And when you look at their before and afters, you like the way that they look, and that is the look that you're going for. What the advantages have been, textbook-wise, with a deep plane facelift is that you can get a little bit better lift in the mid-face. So this means these lines here and underneath your mouth here, that they're saying that you can lift that a little bit better. Because what you do with a deep plane facelift is you go underneath the skin and then underneath the muscles that control smiling, laughing, moving your face, and you move all of that as one piece up back where you want it to be. With a submuscular aponeurotic system facelift or a SMAS lift, what we're doing is lifting up the skin. We're taking that layer, which is actually a very thin layer of muscles, and pulling it back up, almost like whenever you make a bed and you grab the blanket and you pull it back up to where it's supposed to be. And so rather than going underneath the muscle, we're grabbing it and we're putting it where we want it to be, and then you suture it in place. And the sutures depend on the surgeon. Are they permanent sutures? Are they dissolvable sutures that take a long time to dissolve? You can use either, and both are good. And so it's just two different ways to get to the same endpoint. But honestly, whenever you go to the meetings and you look at the different people's outcomes, they're both very good. So it kind of depends on what is your surgeon comfortable with, what are they comfortable with with your type of face and neck, and to get the result that you want. So it's just really good to have that conversation with your surgeon of what they do, how they do it, and how they get the results that they have to be able to show you. I also would like to explain what a submuscular aponeurotic system is. That's a lot of words, but what that is, what we call it the SMAS, which is much easier to say. So that is a very thin layer of muscles. You have your skin, your fat underneath your skin, and then that layer of muscles, and that is what controls your smiling, your laughing, your moving your face, and this is where we see the descent over time that creates things like jowls and these lines here and these lines here, and that's what we are moving back up to where we want it to be to make you look more youthful. Between the deep plane and the SMAS lift, it's just two different ways, either going on top of it to lift it up or going underneath to lift it up. The advantage of a deep plane lift is if someone has some trouble healing, if they're a diabetic, or if you want to try to do the surgery in someone who is a smoker, although that is kind of risky, you have a thicker flap, meaning the skin and the muscle all move together. So you're moving all of that vasculature together instead of moving the muscle and then putting the skin over it. The benefit of the SMAS facelift is it's slightly safer whenever it comes to the facial nerve. So that is the nerve that controls the muscles that help you smile, frown, raise your eyebrows, move your face. And the way they come into those muscles is on the underneath side. And so on the SMAS facelift, you're actually just going on the top of it and moving it where you want it to be, so you're never in the same plane as that nerve. With the deep plane, you are in that same plane, you just have to know exactly where it is, which in the right hands, you'll never have a problem with it, but it's just that extra layer of safety. Also, since you are not lifting underneath the muscles, you tend not to have as much bruising and swelling in the center of the face, so like around the mouth and the cheeks, and so your recovery can be a little bit faster, and in the right hands can have just as good of results. How much does a SMAS facelift cost? This varies by region, by surgeon, are they doing just the top, are they doing the neck and the top? A lot of different variables go into that, but that can vary from $6,000 up to $25,000 depending on all of those factors. Have questions? Call or email anytime. I help people like you every day, and I'd love to talk. Thanks for watching.